Hi, my name is Barry Greenberg. It's my pleasure today to be chairing this panel with a wonderful group of guests, Dr. Julie Zissimopoulos, Dr. Van Top Park, and Dr. Monique Nugent, who will all introduce themselves as things get handed off to them. I am an associate professor in the Department of Neurology at the Johns Hopkins School of Medicine in Baltimore, where it is currently raining and a very nasty day outside. Um, I am also the editor-in-chief of one of the Alzheimer's and Dementia journals, the one on translational research and clinical investigations, which is highly relevant to the topic we'll be discussing today on disparities in Alzheimer's diagnosis. So let me ask my colleagues around the table to do a brief introduction, and then I'll kick off the discussion. Uh, since this is the order of you on my screen, I'll go in that order. Julie?
Hello, my name is Julie Zissimopoulos. I'm an economist and I'm a professor in the Price School of Public Policy at the University of Southern California and a senior fellow at the Schaefer Institute for Public Policy and Government.
Dan?
Hello, everyone. I'm Van Top Park, and I am a professor at the University of California, San Francisco in the School of Nursing, Department of Community Health Systems. And my background is in health education, health policy, ethnogeriatrics, and sociology.
And Monique.
Hi, my name is Monique Nugent. I am a practicing hospitalist at South Shore Hospital, a little bit south of Boston. And I'm also an author, and I write about topics around healthcare access, literacy, and elder care.
Starting off with a little story that's germane to what we're going to be discussing. It was about 2 years ago that my doc said, "All right, it's time. Put me on a cholesterol medication called rosuvastatin." And I spent most of my career as a drug discovery guy in pharma and biotech until I got back to academia in 2008. And as an old pharma geek, if you will, whenever I go on a new drug, whether it's short term or long term, I always read the label because I get it. And I was reading through the label for rosuvastatin, and I came to the part about dosing, and that's when it gave me pause because there was something that really resonated with my work in Alzheimer's disease. And I was prescribed the correct dose for someone who of my background, but there was a caveat that if I had Asian ancestry, I would be required to limit that dose to one half of what was being prescribed for me. And I thought, whoa, we have drugs that we're developing for Alzheimer's disease, and we haven't tested them across ancestries yet. And what do we learn from that? So it also hit me, how was that determined? Well, it wasn't in the initial clinical trials
Hmm.
that led to the approval of the drug that was marketed as Crestor. The regulatory approval of drugs for treating early Alzheimer's disease were based on clinical trials that enrolled highly skewed demographic cohorts. Overwhelmingly, highly educated, non-Hispanic whites of European descent living in communities with extensive medical infrastructure and access to tertiary clinics engaged in the clinical trial supported by the drug sponsors. I'd like to start out by asking Van, uh, and I know the work that you do, obviously, but I would ask you to explain what are the registries that you are enrolling, and please explain why it's important.
Oh, thank you so much, Barry, and thank you for the really great kickoff and introduction background to this discussion here today. So I am the founder and contact principal investigator for the CARE Registry. CARE stands for Collaborative Approach for Research and Education for Asian Americans, Native Hawaiians, and Pacific Islanders in the U.S. And to our knowledge, it is the only and largest research recruitment registry targeting AANHPI adults in the US. It's a multilingual registry. We work with dozens of community and academic partners to engage heterogeneous populations and in many different languages, in Mandarin Cantonese, Korean, in Vietnamese, in Hindi, in Tagalog, etc. And the purpose of this is to, one, provide education about what research is, and why it is important to participate in research. And as you alluded to, Barry, if by participating in research, you can potentially help contribute to the science and about, for example, how does Alzheimer's disease affect me, my family, my community? How can we culturally and linguistically tailor treatments, prevention, services, programs for people who look like me, people who eat similar things like me, people who have similar lifestyles as I do, etc. So CARE was brought about because we know from the literature the low representation of ANHPI populations in clinical research. In fact, in a seminal paper, I think published a few years ago now, in the JAMA Open Network by Dawn and colleagues, they looked into what the NIH has funded in the past 25, 30 years and documented or found that less than 1%, and actually not even 1%, 0.17% of the total NIH budget went to support clinical research for NHPI populations. I don't think I need to really spend so much time going to why that is just a very sad statistic. And with that, and I say we, meaning myself and many community partners and academic partners as well, really felt the need and felt compelled to try to make, I guess you can say, a big difference. We've been doing a lot of community-based research over the years together, but how can we try to make a big difference in a large way across the US? And that's why we developed the registry. And now we have, and since its launch a few years ago, we have more than 12,000 people enrolled. And I want to say that these 12,000 people and counting, more than 80% reported no prior research participation experience. So that is something we're very proud of. And we hope that researchers and funders will realize that ANHPI communities really do want to engage in research if you actually outreach to them with trusted sources of partners, and in the language that they speak, in the communities that they live. And we have received dozens and dozens of research requests from researchers to use CARE as a registry or recruitment source now. And for those who have been contacted from the registry, we have really high statistics in their in terms of them consenting and enrolling in research.